Hello, I'm Dr. Wickham Simonds. I'm an obesity medicine specialist and I practice obesity medicine in the Triangle area of North Carolina. This video series is called Obesity Medicine Perspective, and in recent videos I've been talking about diet and the role of insulin as a fat storage hormone and the role of some medicines that affect insulin. The most recent one we talked about was metformin. And so in the last video I showed you a pictorial of a child with type 1 diabetes at diagnosis and after 4 months of insulin, and I show you how the child gained weight and gained fat in response to the insulin therapy. And I said, this is how insulin works, and if you're an adult in the United States and you've been eating a lot of carbohydrate, well, then you're going to raise your insulin level because you have to control your blood sugar. And when you have a high insulin level, you're like that child now taking insulin supplements. You're going to gain a lot of weight and body fat. And unfortunately, the American diet is very rich in these carbohydrates, and we do this over a lifetime. And as a result, we are the largest and fattest nation that has ever existed on this planet. So I want to stay on this subject. I've been asked the question, well, how much carbohydrate is okay in the diet? And before I really ever answer that question, because it's kind of different for each person, I want to give you an idea of how much sugar is in your bloodstream and that it takes to run your body at any one time. It's a lot less than you think. So I was at a lecture in the spring when Dr. Eric Westman at Duke University gave a lecture on the history of the treatment of type 2 diabetes, and he had a picture in the lecture that showed just how much sugar is actually in your bloodstream, and I've copied that off to show you so that you can see what that is. Now, there are 5 to 7 liters of blood in your bloodstream, and each liter has about a teaspoon of, or correction, has about 1 gram of blood sugar, okay? So in this picture here, you can see the sugar is actually in the spoon, and there's only 5 to 7 grams in your bloodstream at any one time. This is all that it takes to make your body run correctly. It's less than 1 teaspoon. So it's 5 to 7 grams, less than 1 teaspoon. I want you to remember that. That's all you need. So I showed you that so that when we talk about, well, how much carbohydrate is okay for me, well, when you start talking about American meals and the number of grams of carbohydrate, remember the carbohydrate is converted to glucose or sugar. So that pictorial should be in your mind now, okay? So if you're going to eat a plate of pasta, the average plate of pasta will have 200 grams of carbohydrate. That means it's going to get converted to 200 grams of glucose. You only need 5 to 7. So that is an overwhelming amount of glucose. Even 40 or 50 grams is way more than you need. And so in response to that, your body is trying to keep you from having this massively elevated blood sugar and having diabetes. And this is why it has to secrete all of the insulin from the pancreas. And it's insulin that's causing all of these problems. It's making you fat, and in particular through your midsection. The insulin signals your liver to take all that extra glucose, to store it as fat, and this is at the root of the problem. So when we teach you a diet that restricts carbohydrate, this is the reasoning behind it. When we give you an appetite suppressant to help you with the diet, this is the reasoning behind it. When we add metformin to your regimen to lower that insulin level, this is the reason behind it. It all works together, and this is at the root of the problem. So I cannot drive this point home enough. I just really can't emphasize it enough, and I'm going to continue to emphasize it over and over and over again because it is the primary problem that we have in this country. And restricting carbohydrate, not restricting fat and protein, this is the way to go. It's a simple rule on your diet. It should consist of proteins, fats, and vegetables. And the other kinds of foods that are out there should be consumed in very small quantities. And that is a good rule to follow from this point forward in your life. And we will help you with that. We'll teach you those concepts, and we'll provide medicine for you that helps. I'm going to encourage you, if you like this kind of information, to continue to follow us on our Facebook page. Continue to follow us on the Dr. Simonds Twitter feed and on this YouTube channel. We're giving away body composition analysis tests that are performed on the InBody 770. The InBody 770 is a dynamic, high-speed technological tool that can tell you exactly what your body composition is. And that test normally costs $40, and if you'll follow us on our social sites, we're going to give it to you for free. So please follow along. We want you to do that. And until the next video, I'll give you the tools and the instruction. You give me the effort, and together we'll overcome obesity.